Elie Wiesel, Holocaust survivor and author, once stated that human suffering anywhere concerns men and women everywhere. We cannot sit idle while people grow ill and die in America's migrant detention centers. And the New York Times is undoubtedly correct when stating that federal officials would do well to implement a comprehensive health care program that focuses on disease prevention. However, they did not provide sufficient evidence of support to efficiently uphold this proposal, detracting from the emphasis of its importance and focused heavily on values to do so instead. So I will be discussing how the use of more statistics and hard data were needed, how they missed a chance to use expert testimony as support, and the misconnection that would express the importance of a healthcare program as a foundational need and constant variable in migrant detention centers. So first, we're going to discuss how they could have used more statistics to back up their main claim and to also illustrate the health crisis in a more rounded way. Examples of statistics they should have included is one noted in a 2019 ICE report by the Pacific Standard, stating that meanwhile, the average length of stay in detention went from 28 to 46 days during that same period. So they're referring to multiple detention centers across the U.S., showing that the length of time they are spending in there is only increasing. Another important statistic shown from the Center for Disease and Control Prevention stated that during September 1st, 2018 through August 22nd, 2019, a total of 898 confirmed and probable mumps cases in adult migrants detained in 57 facilities were reported in 19 states. This clearly showing how widespread the health crisis is across multiple migrant detention centers in multiple states. Instead, they supported some of their reasoning with values as their support, as was noted here. Nonsensical as this is, there's a painfully familiar calculus at work. Deny migrants or refugees humane treatment, including basic medical care, and then when they fall ill, blame them for bringing disease into the country. Next, we will be discussing how they could have used expert testimony to strengthen their argument. They're speaking about a medical program that will be put into place and miss clear opportunities to provide support from experts like doctors and scientists. Dr. Julie Linton, chair of the American Academy of Pediatrics Council on Immigrant, Child, and Family Health, stated in a CNBC interview that children coming into holding centers with a sense of resilience, Linton said, and potentially stronger immune systems, but the stress from being held against their will can cause immune systems to tank. This only stressing the need for disease prevention in migrant detention centers. And the American Medical Association stated that we strongly urge the administration and Congress to work with the medical community to develop policies that ensure the health of children and families is protected throughout the immigration process. There also should have been a clear emphasis on why an established healthcare program has to be a constant variable, because policies and laws can change when it comes down to the length individuals will spend in these detention centers. So there was missed opportunities to express this as a supporting idea by showing the Flores settlement as an example of this. While the impacts the Flores settlement had were given, they failed to make the connection that legal policies like this one will continue to change, only stating that proposed regulations were published in the Federal Register on Friday and could take effect after 60 days. So in conclusion, it is undeniable that there is a dire problem in these migrant detention centers, and any attempts at solutions are greatly appreciated. However, simply stating why things are bad and then creating a proposal will not incite a will to change by their government. There needs to be clear and direct evidence and support that can strongly advance a proposal for a healthcare program.